welcome to part 6 of how to start a medical practice. I'm going to be talking about the physical structure or the things that you need to be able to start a practice. I'll use my experience and use other advice that I've given other practices. At the beginning, for many people who may have missed part 1, part 2, part 3, part 4, part 5, you can catch up by simply looking at the different parts on this YouTube channel. However, in summary, we started with forming a practice, that it takes time using a lawyer, using an accountant. And we talked about the different types of practice in New York or professional corporation. Then we talked about location. We talked about insurances. We talked about overhead. We talked about choosing electronic medical records. And we talked about how to build up patients for the practice. Today we're going to talk about something that is important when you start a practice, is getting a building and getting your equipment. Even though I've talked about many of parts of the practice as if there are several different components that occur one after the other, that's not really what happens. At the time when you're starting a practice, you're doing many things at the same time. So when you're writing, Empire Blue Cross, Emblem Healthcare, to join as a provider, is at the same time you are also incorporating your practice. However, one of the reasons why things occur in steps are, for example, there's an old dated practice where many insurance companies, before you join them, want to know that you are affiliated with the hospital. Of course, I believe this is outdated in the essence that many people who are in private practice do not have to go to the hospital at all. And therefore, this requirement that is still present in many insurance companies is outdated and is outmoded and should be removed. People can be in dermatology and never go into a hospital at all, or you could be a rheumatologist and never have to go into a hospital. And you could even be an internist and never have to admit a patient in the hospital. So the requirement to have a privilege in the hospital is unnecessary and should be removed from every insurance company. It is not present in Medicare and it's not present in Medicaid, and therefore it's a completely unnecessary thing in which commercial insurances have. And one of the regulations in many states should be done away with this. This will encourage more people to be able to start practice. Another foolish requirement is requiring a covering physician. It's a foolish requirement and it's an unnecessary requirement in private practice. And by regulation, I hope in a year or so this doesn't exist again in the United States. However, back to the real topic, which is getting equipment. One of the things about getting equipment is that at the beginning it is best to get used medical equipment. For me, when I first started practice, I looked into people who had retired from practice and I found it difficult to find one who had retired from practice. However, I was able to search for old medical equipment from hospitals. You'll be surprised that hospitals don't have old medical equipment because the capitalist society we are is a wasteful society. And once something is not being used by a hospital, it is actually thrown away. And therefore, your ability to be able to get things is really very, very, very low from hospitals. They also sell it to people who actually buy it in bulk, and these are dealers that buy old medical equipment and then they sell it out still at a relatively high price. It's one of the things that you notice that many equipment you still want to buy, you are still buying them at relatively high prices. So they are usually used medical equipment dealers that you can deal with. For example, I live in Long Island, and one of the major used medical equipment company I used, and I think they are still in business now, was GVS. I think they were in Farmingdale. I think they've changed ownership about 3 or 4 times, but these are the people who buy used equipment from hospitals and eventually will sell it to you. And I, contacted them on phone. I was able to buy used examination tables from them, used blood pressure machines from them, used chairs and so on. However, the most cost-effective way is actually getting it from a practice that is closing down, and therefore you could get reception chairs from a practice that is closing down, or they are modernizing, or they are moving, and this is the most cost-effective way to be able to acquire equipment that you need in the practice. And then as the practice grows, you probably may be able to acquire new equipment because you have now the income that's coming in to do that. But the most cost-effective way to be able to start practice is to acquire old equipment. Somebody's going to ask me now, do I remember the address of the used equipment dealer in Farmingdale? I think their name is GVS, and you should be one should be able to Google it if you're in Long Island. But I feel that in almost every town, there's always somebody who deals in this, and I could advise you on the simple things to own. Own just one examination table with a stool, on a chair or a exam or like a business table with a chair where you're able to discuss things with the patient. But in this modern day, you probably do not need that type of a table anymore, as many things are done through the electronic medical records, and you just examine patients using the table and using a chair. You can also order equipment through Staples, Quill, which are what we still use now. I think we used Quill, but before then, there was a company called Medical Arts Press, and through them we're able to order equipment at very low prices, and we are able to have it shipped to the office. So we'll conclude this part on equipment. I've told you how to source your equipment in this particular area, the different sources and what is most cost effective. And in part 7, we'll go on to another area on practice that is important. Thank you.